And now it is an honor for me to introduce our keynote speaker, invited by the class of 2024 to address them today, Dr. Rahel Nardos. Dr. Nardos is an associate professor in female pelvic medicine and reconstructive surgery at the University of Minnesota and is the inaugural director of Global Women's Health at the Center for Global Health and Social Responsibility. Dr. Nardos played a pivotal role in launching one of Ethiopia's first urogynecology training programs, a program that has now trained 7 urogynecologists. Beyond her contributions to education and research in pelvic floor conditions, she is dedicated to health equity work locally and internationally, serving on numerous advising boards and committees, including the United Nations Global Surgery Hub. She resides in Minneapolis with her husband and 2 children. We are delighted to have her this year as our keynote speaker. Dr. Nardos.
Thank you so much for this privilege of being your keynote speaker today. Graduating class of 2024, families, friends, mentors, this is a momentous day. I'm really, really happy to be part of it. I was just telling Denise that I don't remember who the keynote speaker was for my medical school graduation. I just remember the parties afterwards. So I wouldn't be too offended if you didn't remember this. But first off, I just want to congratulate you for this momentous achievement. Getting to where you are today is no easy feat. So much has happened in the last 4 years in the world, as well as right here in our own backyard, that has called for your resilience and your awakening, as was mentioned previously by Dean Toller. Today is a culmination of your life story, the communities that supported and inspired you, the events that challenged and transformed you, and even the strangers who came into your life and showed you that compassion is possible from the most unlikely places, just enough to steer you in this direction. When I see your faces, I imagine a canvas where each of you add your unique color and contour of your life stories, creating this beautiful image. And the more diverse your life stories, the more power this image has to reach and connect with patients, irrespective of where they come from or what they look like. This image has the power to transform not just the life of Minnesotans, not just the life of Americans, but the lives of global community. So speaking of the power of life stories, if you had asked me, when I was a little sickly girl growing up in war-torn Ethiopia, that I would be in this room speaking to you today, I would have thought that you were delusional. I used to get sick a lot, mostly from preventable diseases, lack of access to clean water. And the first line of defense was always my mom and her army of women friends who lovingly offered their herbal concoctions and their holy water. But what I remember the most is the healing power of their love and compassion. When my mom's interventions failed, which sometimes they do, I used to seek care in overcrowded, poorly equipped, poorly staffed government hospitals for ailments that could have been prevented in the first place. I remember the exhaustion on the doctors' faces and the crowded clinic rooms. It was not a healing space. Perhaps that's why I care so much about preventing disease as I do curing it, why I have so much respect for the role of communities to heal, and why I spend half my time working on building healthcare capacity in other countries, as I do in embracing the innovation and the latest technology to help care for my patients right here at home. We are the product of our life stories. My colleagues sometimes tell me that I don't think like a surgeon. They mean that as a compliment. But I don't see why surgeons can't be public health advocates and global health champions, and why they can't fix bladder surgically and still embrace holistic care. Why can't we be specialists and still think like generalists? Why can't we practice medicine locally and still think globally? Why can't we collaborate with engineers and business leaders and public health leaders and public policy advocates and even movie directors to revolutionize the way we care for and advocate for our patients? We can and we should. So what I have learned over the years is that to accomplish this revolutionary acts in medicine, we need more than a good medical education. We need to commit to a few good habits. I call them habits of the mind. And let me share just a few habits that I have found to be game changers for me, and I'm still a work in progress. So take it with a grain of salt, okay? So the first habit is asking yourself every morning diligently, how do I want to show up in the world today? Just a simple question. And most likely, you want to show up as the best version of yourself. And one of the most indispensable ways to show up as the best version of yourself is to be well in mind, body, and spirit. When I see my patients in the morning before their surgery, they sometimes ask me if I've had good night's sleep. I always check myself and say, well, what are they seeing here? They ask me if I had my cup of coffee. They usually know I like my first cup of coffee in the morning because I usually tell them not to drink coffee to avoid bladder irritation. So I always admit to them that I do drink coffee in the morning. I even have patients who send me nutritional tips when I tell them that I'm a diabetic. Patients know that we're humans and that we can't take good care of them if we don't take good care of ourselves. I did not prioritize my own wellness for a long time until a few years ago when I buckled from the loss of my young brother suddenly and a serious chronic medical condition. My family used to call me the Iron Woman. I don't feel like an iron woman when I'm injecting insulin every morning before I put on my scrubs to go to the OR. Our profession is supposed to be about healing and compassion, but we are often treated as superhuman, where showing vulnerability is seen as a weakness. This is not okay. My advice is challenge and change the culture from the inside. You are part of the culture. Prioritize your wellness above all things. Question your internal and external motivations and expectations regularly. Redefine success if you have to, but don't be a hero. Be a human being and a human doing. The second habit that I have gotten to really appreciate is the habit of being present. I remember one patient, she was a nurse, who at the end of her visit, as I was walking out the door, she told me that I was the first doctor in a very long time who has actually not looked at her computer while I was talking to her. She was surprised I did not even turn on my computer in the exam room. She said she felt heard. The beautiful thing about being present is that aside from building trust, which is the cornerstone of a doctor-patient relationship, you also pick up on physical and verbal cues that actually help you make better diagnosis and help you make more acceptable treatment plan that works for the patient. I tell patients that they're with their bodies 24 hours a day, every day, and they're with me for 30-minute visit. Which one of us do you think have a better insight into what's going on? No number of diagnostic tests and medical knowledge is going to replace the insight that the patient brings about the history of their ailment and what may or may not work for them for treatment. But being fully present is not our default. mode. The average human attention is something like, 8.25 seconds? Well, women's attention span is a little bit longer. But I found, even when I don't have time, taking 5 minutes in the morning and sitting still and getting to know the nature of my crazy mind and setting intentions for the day is a very powerful thing. When you verbalize your intentions, even for yourself, it has a very powerful impact of actually becoming true, because you don't want to catch yourself telling yourself that you're going to do something and you don't. So it's a powerful tool. So for example, on the days that I'm in clinic, I tell myself today, I'm going to walk for 30 seconds between every patient. I'm going to walk around the clinic hallways once, even if I am running late. And I always run late. And when I am in the operating room on the days that I'm going to the OR, even though I've been doing surgeries for 15 years, I feel very confident in my surgical skills. I tell myself, Rahel, have some grace, even when they give you the wrong glove sizes, which will happen sometimes. Be humble and don't be a hero. I tell myself that every time I go to the operating room. Why? Because I know that my privilege comes with a lot of ego. Humility can win you a strong team who has your back in the operating room, and knowing your limitations will save your patients' lives when things get complicated or go wrong. And if you do enough surgery, that will happen. So I'll leave you with one last habit that I found very helpful. That's the habit of reframing. What do I mean by reframing? In medicine, we're trained to diagnose and treat, and our measure of success is curing the disease. There's nothing wrong with that. I'm a surgeon. I love fancy tools, even robots, to do surgeries and fix vaginal prolapse, which is a devastating pelvic floor condition that comes from childbirth. I thought I would use this opportunity to educate the public about pelvic floor. I never have this many people in the audience, so sorry. It's gratifying to fix vaginas. So a few weeks ago, I had a 65-year-old patient who was coming for a postoperative visit, and she said to me, Dr. Nardos, I feel like I've been born again. I no longer have something hanging between my legs, and honestly, I don't know how men do it. So you can really get addicted to these wins. But what happens when we can't cure or even figure out what's wrong with our patients? Does that mean we failed? Does that mean the patients failed? We are very good about saying the patient failed treatment. Patients don't fail. Treatments fail them. I had a friend who died from stage 3 ovarian cancer 2 years ago, and she said the worst part about her treatment journey was that her doctors kept telling her she failed chemotherapy. So what if we reframe our measure of success from curing to relieving the suffering of others? How would that change how we approach patients in general? What is powerful about reframing, this particular reframing, is that you can relieve someone's suffering even when you can't cure their disease. So if you do it right, nobody fails. But relieving someone's suffering requires something beyond medication, beyond surgery. It requires your wisdom and your compassion. The Buddhists define compassion as a genuine desire to relieve the suffering of others that requires being present, being well yourself, and recognizing that others are just like us. The hardest thing about developing compassion is that you have to cultivate this attitude daily, and you have to show it even to your most difficult patients. Even when you're tired, those who practice the art of compassion will tell you that the challenging patients are in fact your best teachers. They're the ones you're training for. It is very easy to be compassionate towards patients or people who like you or who listen to you, who agree with you. It's much harder to do so with those who challenge you. So next time you anticipate interacting with a challenging patient, you tell yourself, here is my golden opportunity to practice my compassion. And I'm here to listen and relieve her suffering, even if I don't have a cure. Thank you and congratulations.